Hello, welcome to another session of Nurse Talk. In today's session, we are going to have a continuation from the previous video where we are going to discuss the question paper of previous exam. Okay, so we have already finished the questions till the 22nd one. Today, we are going to discuss 23rd question of Sri Chitra Tirunal Institute or Medical Science, Trivandrum. So the 23rd question is, when assessing the lower extremities for arterial function, which intervention should the nurse perform? Option A is assessing the medial malleoli for pitting edema, performing Allen's test. Option C is assessing Homan's test, and option D is palpating the pedal pulses. So the answer of this question is the question is arterial functioning, assessing the arterial functioning of lower extremity. So this is saying about pitting edema. That's not the answer. Second one is Allen's test. What is Allen's test? Allen's test is used to check the patency or capability of arteries of the arms, especially for doing the procedure of IV cannulation. We are checking the Allen's test. So Allen's test always come for arms. So this is not the answer because they are asking for lower extremities. Assessing the Homan's test. Homan's test is used for the diagnosis of deep vein thrombosis. So that is not the answer. Sorry. The last option is palpating the pedal pulse. So pedal pulse is palpated in the legs. So they are asking the question, in the question they are asking about lower extremities. So pedal pulse is the answer. So palpating the pedal pulse. Option D is the answer in here. The next question is, while auscultating the adult patient's lungs, the nurse hear loud bubble sound during inspiration that do not disappear after patient cough. Which finding should the nurse document from the lung assessment? So in the options they have given 4 types of respiratory sounds or auscultative sounds which can be heard from the lungs of the patient. First one is ronque, second one is coarse crackles, sibilant wheeze and pleural friction rub. The answer of this question is coarse crackles. It is an abnormal low pitched bubbling sound. So whenever you hear bubbling sound, remember that is crackles. Bubbling sound is crackles, and crackle sound, these chorus crackles are especially heard during inspiration. And the question clearly asks, the bubbling sound is heard during inspiration. So remember, the chorus crackle sound are commonly heard in the disease conditions of pneumonia, pulmonary edema, chronic bronchitis, like that disease condition. So bubbling sound, especially during inspiration, that is chorus crackles. Okay. The 25th question is, patient effort to manage psychological stress is known as. So we have already did a class on defense mechanism. So in that class I said coping is a term used for the patient's effort to make psychological stress. So we are trying to cope. The patient is trying to cope with the situation. So that is coping. So the patient is effort to manage a psychological stress is called coping. 26th question is, nurse assist a patient in connection a stressful event with a patient reaction to the event. The approach is known as. So in this question, the question says the nurse is assisting a patient in connecting a stressful event. The patient is passing through or going through a stressful event, and we are going to assess the patient's reaction in that event. So what is the nurse doing here? What the name of the approach is? First one is evaluative care. No, this is not an evaluation. We are not evaluating, but we are asking the patient to go through a stressful event. So this is not the answer. Second one is problem solving. Third one is situational intervention. And fourth option is crisis intervention. So these are the questions. So what is happening here? The patient is, no, we are not giving any problem for a patient. So this is not problem solving. The patient is not trying to solve any problem. But we are not giving a situation here, but what we are giving is a crisis. We are providing a patient with a crisis. Stressful event is actually a crisis for a patient. So we are going to assess what is the patient's reaction. Reaction is the intervention. What the patient is going to do in that stressful situation to cope up with the situation. So the stressful event is a crisis and the reaction is the intervention what the patient is doing. So the answer of this question is crisis intervention. This is not problem solving because we are not giving a problem to a patient, but the patient is passing through or going through a crisis or a stressful situation. So the answer of the 26th question is crisis intervention. Next question is the normal potassium level in the blood of adult. So we have to by heart all the normal levels. So in this case, in this question, the answer is option C, 3.5 to 5.2. So how I always by heart this level by 3.5 to 5.3, just like opposites, 3.5, 5.3 MEQ per liter. So this is how I by hearted this. You can use the same technique, or you can read just 3.5 to 5.2 milliequivalent. That is a normal potassium level. Potassium. Okay. So the next question. Before the nurse wash hands when leaving the isolation room, what is the last thing that is removed? Very, very important. This question or this topic we studied it in the in the first year nursing foundation. So this, what is the answer of this question? When we study about doving and doffing, so doffing means taking off the personal protective equipments after while leaving the isolation room. Remember, the first thing to take off is the gloves. Second is the apron or gown. Third one is goggles. Fourth one is mask. Mask is the last one to remove while coming out or leaving an isolation room. So remember, first and foremost thing what we will do while coming out of an isolation room is the gloves. Remember, while we are doing a procedure, the most contaminated thing would be the gloves. So we will remove the gloves first, and then we would remove the apron or gown. Then we will remove the goggles, and the last thing to remove is the mask. After removing the mask, we will do the hand washing. So this is the doffing process. Remember, the doffing process of nursing by coming out of the isolation room is gloves, apron, goggles, and then mask, and then we'll do the hand washing. So the answer in here is, the question is, nurse washes hands while leaving an isolation room. What is the last thing that is removed? Last thing that is removed is option B, mask. Okay. So the next question, to remove a glove that is contaminated, what should the nurse do first? This is very, very easy question for all of us. We all know how we remove the gloves. First option is, grasp the outside of the cuff or palm of the gloves and pull it away from the hand without touching the wrist or fingers. Option B is, put the thumb inside the wrist to slide the gloves over the hand with minimal touching of the hand by the other gloved hand. Option C, pull the glove off the back of hand until it slides over the entire hand and discard it. Option D is, rinse the gloves before removing them to minimize contamination factor. Obviously, we know this is not the one. We are not going to wash the gloves. And we also don't know, we also know we are not doing the pulling the gloves off back the hands until it slides off. No, we cannot do that. We are making it more contaminated. Among these two options, see the first option. See the second option or option B. Put the thumb inside the wrist to slide the gloves. Do we do that? We will make sure that our hands or the gloved hands are not coming in contact with any of our skin. So this option says, put the thumb inside the wrist to slide the gloves over the hand with minimal touching. We don't need any touching. So this is not the option. The first option is, grasp outside of the cuff or palm of the glove, pull it away from the hand without touching the wrist or finger. So this is the right answer. So we are going to grasp the outside of the cuff and we are going to pull it outside. We are not going to touch anything anywhere. Okay, so that is option A is the right answer for that question. Next question is, which of the following is a common condition that causes numbness, tingling, pain in the hand and forearm? So remember, the hand and forearm is affected in the disease condition carpal tunnel syndrome. In carpal tunnel syndrome, the nerves in the wrist is affected. Wrist. So the numbness, tingling and pain will be obviously present for the patient on the hand and forearm. So remember, the question number 30, the answer is carpal tunnel syndrome. Next, very, very easy question. Night blindness is caused due to deficiency of, obviously we all know the night blindness is caused by the deficiency of vitamin A. So the 31st question answer is an option A. So the question number 32, which of the following vitamin is not fat soluble? Remember, fat soluble vitamins are A, D, E, K. Remember that. Read it by heart, like you have to remember it by heart. Fat soluble is A, D, E, K. So we all know A is fat soluble, D is fat soluble, E is fat soluble and K is fat soluble. So what is not fat soluble? It is option C, that is vitamin B is not fat soluble. So the next question is, which of the following is the most sensitive indicator of neurological status? So once we have a patient, first and foremost thing what we'll check is consciousness of the patient. Most sensitive or early indicator of changes in neurological status is loss of consciousness of the patient. So first we will check if the patient is conscious. We will shout her name or his name to make sure the patient is responding, and then we will go to the pain or vascular flow or memory, whatever. First and foremost thing or sensitive indicator is always loss of consciousness. So the answer is option A. And 34th question is, patient with bacterial meningitis demonstrate which one of the following? So the patient's meninges is inflamed with bacteria. Remember, if a patient has a bacterial meningitis, patient will always have decreased glucose level. Patient will have a decreased glucose level and increased protein level. So what will happen here? The glucose of the patient's CSF is going to decrease and protein is going to increase in bacterial meningitis. So increase in glucose CSF is not the answer. Option C, decreased CSF protein, not the answer. Increase in magnesium level, not the answer. The answer is in bacterial meningitis, the glucose of the patient will decrease. Okay, so the option A is the right answer. 35th question, sphenoidal approach is used in excision of which type of tumor? Glial tumor, pituitary tumor, oligodendrogliomas, acoustic neuromas. Transsphenoidal approach, that type of approach is used, is a type of surgical procedure where the surgery is done through the nose of the patient. The patient's transsphenoidal, we know mastoid, sphenoid, they are all sinuses. So through the sphenoid process, if the surgery is done, that is done for pituitary tumors, especially pituitary adenomas. In case of pituitary adenomas, the patient will be having a transsphenoidal approach for the excision of the tumors. Remember, pituitary adenomas are done transsphenoid or through the nose of the patient. Surgery is done through the nose of the patient. Next question is, which of the following is an incorrect match? Let's see. Option A is dysphagia, inability to speak. That is wrong. Dysphagia is difficulty in swallowing. Difficulty in swallowing. Dysphagia. Hemiparesis is weakness, that is right. Hemiplegia is paralysis, right. Aphasia is inability to communicate. So incorrect match is dysphagia, inability to speak. Dysphagia means difficulty in swallowing. And the 37th question is, phenytoin, carbamazepine, valproate drugs are classified under category. So this question is coming under neurological or mental health. Both can be the topic for this question. So the option A is neuromuscular blocking agent. Option B is anti-epileptic drugs. Option C is antidepressant, and option D is antipsychotics. Remember, the valproic acid, whenever you see valproic acid, remember that is used for epilepsy or seizures. And phenytoin, we studied in this topic of seizures. It's a medication, it's a first line medication used for seizures or epilepsy. And remember, when we were talking about seizures, we were saying about lorazepam, IV lorazepam or diazepam, rectal diazepam is given for the patient with the seizures. So phenytoin, carbamazepine and valproate are the drugs used as an anti-epileptic medication. So the option B is the right one. It is anti-epileptic drugs. Hope you got some idea about the questions previously asked for the government examinations in India. And please continue watching.